I'm Shawana Wheeler, and today I want to talk to you about case management home visits and the impact that it may have on hospital readmissions. First, I would like to start with the definition of case management according to the Case Management Society of America, or CMSA. Case management is a collaborative process of assessment, planning, facilitation, care coordination, evaluation, and advocacy for options and services to meet individuals and families' comprehensive health needs through effective outcomes. So, the outcomes that we would like to achieve is to reduce hospital readmissions by implementing case management home visits. So, case management has been proven to be very effective in the hospital at managing healthcare dollars. Patients that have multiple comorbidities account for 66% of healthcare costs in the United States, according to Ju and Liu 2016. So, first, let's start with the research question. One question that has continuous need for research is: does case management home visits for the elderly Medicare population with chronic conditions reduce hospital readmissions? Now, this question is very thought provoking because many nurses and case managers perform on a daily basis trying to reduce ADK, which is admissions per thousand, as well as ERK, which is ER admissions per thousand. They do this and really don't know what the reasonings are for doing it. However, the reasonings are so that there can be better benefits for Medicare recipients and revenue can be increased for Medicare. So, it's imperative to know this research question. So, let's talk about the effects of home visits. What are the effects of having a case manager to have home visits? Well, it will reduce hospital admissions, and the total annual cost of Medicare is over $583 billion, according to Pender. So we want to make sure this amount is reduced by implementing our case management into the home environment. Blue Cross and Blue Shield of Arizona has a case management program that provides one home visit for qualifying members, which help them to reduce their readmission rate to 13%, according to Home Visits Help 2013. So let's talk about the focused population. Our population of interest would be men and women ages 80 and above and who are on Medicare. There will also be dual eligible. And by dual eligible, I mean those that are eligible for Medicare as well as Medicaid. These are our very low income population. According to Jacobson, Newman, and D'Amico, dual eligibles tend to have higher medical costs and have severely debilitating chronic conditions compared to our younger duals that are 65 and younger. So this is why we want to focus on this population. So also our population must have multiple chronic conditions because we want to see if these case managers can get into the home, help them to control these conditions at home instead of readmitting to the hospital. So we'll talk about the variables next. So the variables in this study would be listed as: the dependent variable would be case manager home visits, and the independent variable would be hospital admissions. The variables will be using a nominal scale as well as an ordinal scale. So the nominal scale will ask, have you ever had a case manager to visit you in your home? The letter Y would represent yes, and the letter N, of course, would represent no. So it's important to know if these subjects have ever had case management in the home because it would be a better indicator as to if that case manager in the home helped them to control a readmission. The ordinal scale will have the variable listed as hospital admissions within the last 6 months. And the values will be listed as follows. 1 would be no hospital admissions. 2 would be 1 hospital admission. 3 would be 2 hospital admissions. And 4 would be 3 or more hospital admissions. So how will we go about obtaining the samples? So our samples will be collected by using face-to-face interviews from subjects from a subset of patients that are admitted to the acute care setting in the hospital. So first we would have the on-site utilization nurse to begin the process after reviewing the patient's past medical history, their past surgical history, and their home medications in order to see if they qualify for the study. The on-site nurse will point out and interview those patients that meet the qualifications. Remember, they are 80 and above, they are dual eligible, and they have multiple chronic conditions. So we will have a sample size of 100 participants. So we will have 50 participants in the control group and 50 participants in the study group. Chow and Wong in 2014 conducted a recent randomized controlled trial of case management program for older adults who had discharged with multiple comorbidities, and they utilized a three-group comparison with a sample size of 74 participants for each group. They had 1 control group and 2 study groups. So our sample size is based off of this particular trial study. So once we obtain the sample, how will we go about collecting our data? So first we're going to, after the on-site nurse has collected the information for the study, we will obtain verbal and written consent from our participants. We're going to provide the patient with the initial measurement tool and make sure that they complete it. And then the qualified participants list provided to the community home-based case manager, who will then conduct a telephone interview with the patient upon discharge home. So our control group is going to receive 1 telephonic follow-up, while the study group will receive a combination of telephonic as well as home visits. Since this study is determined if home visits will make a difference in readmissions, there must be a group that does not receive the variable. So this group is our control group. So the study group will receive 3 different visits. They will receive 3 different visits post-discharge from the hospital. And they'll have a questionnaire to complete after each visit over a 3-month period. And we'll go to the next slide here. So according to McIlvaine, Epen, and Allen, 20% of patients who discharge and have Medicare will readmit within 30 days. So it's important for us to make that first initial visit within the 10 to 14 days of discharge from the hospital. So the first visit will be that 10 to 14 days. The second visit will be conducted 30 to 45 days post-discharge. And then the third visit will be 60 to 80 days after discharge. So once the case management has done their part, they will pass out a questionnaire. The questionnaire will consist of a self-evaluation of the patient's health at each visit using a Likert scale. And this is the same scale that was used in the study by Chow and Wong in 2014. And the patient will be asked to rate their health on a 5-point scale ranging from excellent to poor. So this questionnaire is going to give us a good indication as to whether the patient feels that their condition was controlled at home with the help of the case manager visiting and providing the needed education. So during each visit, the case manager will provide education specific to the patient's disease process. They will perform medication reconciliation and evaluate their understanding of their treatment plan. The case management will also make sure the patient has necessary equipment at home that could possibly cause a readmission if they did not have this. So, in conclusion, performing the data collection process will allow for a better understanding of how patients feel about their health as well as if the nurse case manager making home visits has any type of impact on them and their treatment plan. In a literature review conducted by Ju and Liu, they concluded that there was a significant reduction of hospitalization use with the initiation of a home based case manager. The review also concluded that the implementation of a case manager reduces healthcare costs. So, by utilizing the listed data collection process, there should be a significant difference in the experimental group and the control group when it comes to readmission to the hospital. So, overall, the goal would be to increase benefits for Medicare recipients by decreasing hospital and ER admission. This can be done by having a nurse case manager in the home to reinforce the treatment plan and teaching the patient how to become more confident in treating themselves at home or at their primary care physician's office. Thank you very much for listening, and I hope this presentation has helped you.